Hi there everybody and welcome back to my channel. Today I will be talking about expectations when it comes to surgery, particularly cataract surgery. So if you want to learn more about this, then please stay tuned. Okay, so you've received a date for your cataract surgery. You've probably waited a very long time due to issues with waiting lists, and therefore you are both excited and a bit apprehensive. If you've had one eye done, then you will more than likely know what to expect. However, a couple of common questions that patients have, which I want to address today, include: will I need glasses after the operation? And secondly, will I see better than I currently do? Now, if I take the first question, which is, will I need glasses after the operation? You attend your optometrist prior to the operation to obtain an up-to-date prescription, which then allows us to calculate what lens to put into your eye so that we can give you a set defined target outcome. So what I mean by this is, if your prescription, for example, is -3 in both eyes and you're due to have a cataract operation, we will more than likely leave such a patient being ever so slightly short-sighted, so we would aim for somewhere around -0.25. This slight short-sightedness will mean that they still will potentially be able to read close up, but they will not require glasses for the distance. However, the full benefit of this will only be realized when the other eye is done at some point when it is deemed to be appropriate. Now, these lens calculations are estimations, and despite them being very accurate, they can sometimes not perform as well as we would like. So you can get something called refractive surprise. This can happen rarely, and we do warn patients about this. So whilst we endeavour to leave patients not needing glasses for the distance in the majority of cases, and we tell patients that they will require glasses for reading, sometimes this does not go according to plan, and therefore it is important to recognize this. Secondly, what does happen sometimes is patients may have an advanced cataract in one eye and a very small, moderate degree of cataract in the other eye, if any at all. In such a case, them needing cataract surgery for the other eye is not going to happen for some time, and therefore we will adjust the power that we put into the eye via the lens accordingly to factor this in. So in such an instance, if they wear glasses to begin with, then they potentially will still need to wear glasses after the operation. The second common question then is, how will my vision be after the operation? Now, in the vast majority of cases, the fact that we are performing cataract surgery to begin with means that we are optimistic that the vision will improve and therefore be better than it currently is. Otherwise, we would not entertain performing the surgery, because surgery does not come without risks. However, some patients do have underlying problems in the back of their eyes, for example, or even the front of their eyes, which mean that we give them what's called a guarded prognosis. So let's discuss a few examples. A patient may have scarring on the front of their eye because they may have had previous herpetic eye disease. This means that despite us removing the cataract that may be in their eye, their vision will still be poor and not as good as it would have been had they not had the scar. So this is one potential issue that they may have in the front of the eye that will ultimately impact upon the outcome. Secondly, they may have something such as macular degeneration, and associated with this, they may have scar in the back of the eye, or they may actually have wet macular degeneration, which means they may have fluid and or blood in the back of the eye. Now, both of these will mean that regardless of what you do to the cataract in the front of the eye, and even if you insert a new clear lens, this will not change the condition in the back of the eye. So their vision in this instance will ultimately be limited by the pathology/disease in the back of their eyes. It is very important to communicate such findings to patients because they may be under the impression that having cataract surgery and having a new lens inserted will cure all of their problems and their vision will be restored back to how it was prior to them developing the cataract. This is where a careful consultation with the patient and ensuring that they fully understand what it is you are aiming for whilst performing the surgery is crucially important. And finally, the other common question is, how quickly will my vision become as good as it can? Now, the answer to this is it is completely dependent upon A, how straightforward your surgery was, B, whether any complications occurred, C, whether you have any underlying problems, etc. In the vast majority of patients, at least by the end of week 1, they will notice a improvement compared to their pre-operative state. However, due to varying degrees of inflammation and different patients recovering at different rates, this can vary. So therefore, it is important to remember that you may not have perfect crystal clear vision after a couple of days. This may be the case for some patients, but not for all patients. I hope you have found this video useful on common questions that get asked about cataract surgery and common questions that patients do worry about. If you've liked this video, please give it a thumbs up, click the subscribe button, comment and do share. Until next time, thank you.